Patient-centered outcomes research, or PCOR, helps people make informed healthcare decisions and allows their voice to be heard in assessing the value of healthcare options. Comparative effectiveness research, or CER, is research that identifies which clinical and public health interventions work best for improving health. PCOR and CER can help health departments effectively address community needs by improving the evidence base of programs and informing approaches to reach specific populations. This video provides local health departments with tips for engaging in PCOR and CER. If you work in a local health department and you're seeking to engage in research, keep these tips in mind. Find opportunities to get involved in and collaborate using PCOR and CER.
Well, my strongest advice for local health departments would be to just get involved. So the only way that we're going to make sure we're conducting research that's truly going to make a difference is if the people who understand the needs and are also responsible for implementing the solutions are working right alongside the researchers. Find out who's doing important work in your area or on topics of most relevance to your community and reach out and see if there are opportunities to collaborate. So before you engage in a partnership, be clear with yourself and your community about what you're hoping to gain, what's going to bring value to your community, and also the level and types of resources that are needed to enable you to be effective partners.
You can learn from a public health intervention used in another jurisdiction and apply it in your community. Adapt a PCOR or CER intervention to fit your community's needs. One example project from Harris County, Texas, applied principles of PCOR and CER and was adapted for use in multiple communities. The project involved using video to observe patients with tuberculosis taking their medication remotely instead of having public health staff drive to the patient's house to make sure their tuberculosis treatment was completed successfully. The VDOT technology intervention performed better than the traditional program. Harris County developed and posted a VDOT implementation guide online to guide other public health departments in adapting the intervention in different communities. If you've engaged in PCOR or CER, you can share your successes and lessons learned with the public health community.
Our work is obviously primarily focused on delivering care and making sure that we improve the health and well-being of our communities. That said, we also have an incredible opportunity to not just prioritize the work of our communities, but to actually make sure that we elevate and highlight that work, the visibility of that work, so it can actually be utilized for other practitioners across the system. It takes a project that is very much theoretical and you show in practice that it works. Then you take that practice and you actually improve the theoretical. So it's really practice-based research that then improves the theory of how do we provide public health practice across the system.